Friends, this is Andrei Berezovsky. It's snowy. It's snowing in Istanbul. We at the Memorial Şişli Clinic, and we have, at least I personally, have filmed hundreds of videos about treatment, hundreds of videos about complex cases, about neurology, about injuries. So for the most part, we've focused on the surgical stage, but we've never touched on the rehabilitation stage, the neurorehabilitation stage, the process of getting people back on their feet from scratch. We're talking about conditions after a stroke. We're talking about conditions after injuries. We're talking about conditions after gunshot wounds or shrapnel injuries. We're talking about conditions after sports injuries or car accidents. A huge range of conditions, injuries, consequences of past surgeries, surgeries after metastasis to the brain or spinal cord, when you are partially or completely immobilized. So this miracle happens methodically. For some, it takes a week. For others, months, and for some, years. But people who are in a vegetative state get back on their feet and continue their lives. Today's topic is very interesting. It's about neurorehabilitation. We're talking with a professor, and he shows how much neurorehabilitation today depends on technology. We will take a look at robotic devices designed to teach you how to walk again, to help you relearn how to move your arms and legs, to put pressure on your foot, and to work on speech. There's a huge range of fascinating things, friends. And it must be said clearly that rehabilitation accounts for, well, more than half of the success after surgery or any other intervention. And the best friends, the very best friends of any surgeon are always the rehabilitation specialists. It's an incredibly interesting topic. Nothing like this has ever existed before. There are so many questions about rehabilitation. It's a complex, expensive topic, not just in terms of money, but also in terms of time, because if you want to learn to walk again, you'll have to spend a huge amount of time on it. But you can do it. Unfortunately, strokes and brain injuries in general don't make you younger, but the doctor says that there are a lot of strokes among young people under 30, even under 20. This has become a huge issue, and these people are just starting their lives, and they have to learn to walk, talk, eat, control their arms and legs, their bodies, and maintain balance all over again. In general, it's a fascinating topic from Istanbul, from Memorial Şişli, about rehabilitation. We show you everything, we'll explain everything. The doctor will answer all your questions. Andrei Berezovsky, X-Explorer channel. Neurorehabilitation. Let's go. Basically, we are a department of physical medicine and rehabilitation, but we focus on neurorehabilitation. The most common patients in neurorehabilitation are those with ischemic or hemorrhagic stroke, as well as those with traumatic brain injury and multiple traumas. It is very difficult to manage such patients. In this hospital, we are able to handle these patients because we work as a multidisciplinary team with all the specialists. For example, when we receive a patient from another country or another hospital, the patient is first assessed by a rehabilitation physician. Then we consult with neurologists, neurosurgeons, internists, and, if necessary, pulmonologists, intensive care doctors, and ENT specialists. All of them assess the patient, and the team of doctors decides what actions to take. We are able to handle all conditions. For example, if a patient has a traumatic brain injury along with other conditions, such as multiple trauma, a pelvic fracture, or lung problems, we manage them together with other doctors. Our neurosurgeons and orthopedic surgeons have extensive experience. If we admit a patient with injuries, they can handle everything. We have a large team. We are physicians specializing in physical therapy and rehabilitation. We also have many therapists, physiotherapists, occupational therapists, and respiratory rehabilitation specialists. There are also speech therapists and swallowing specialists. All of them work together. We also combine all therapies with robotic rehabilitation. We have an excellent robotic department equipped with the most advanced devices for robotic gait training and robotic hand therapy. We also have anti-gravity treadmill and computerized balance trainers. We combine all these treatment methods depending on the patient's needs. For example, if a patient is initially unable to move, we start with a robotic bed for early mobilization. When the patient is stable in a standing position, we begin active robotic gait training. What is especially important is that the robotic walking device is integrated with virtual reality. Patients see an avatar of their own body, and they try to play a game while performing the tasks, which improves their walking motor skills. The same principle applies to arm therapy. If the patient cannot move their arm at all, the robot performs all the movements itself. If the patient starts to move, even a little, they do whatever they can. The robot does the rest. This also helps the brain recover in a more correct way, because if movements are performed incorrectly during the recovery period, it becomes difficult to correct them later. For example, if a person's gait is incorrect, it is very hard to fix it afterwards. But at the beginning, it's much easier to teach and train the patient. So friends, we are, as usual, in Istanbul, as usual, at Memorial. We are at Memorial Şişli in the Robotic Rehabilitation Center. There are millions of conditions that require highly advanced rehabilitation. We usually talk with you about treating some acute phase, but rehabilitation is one of the most important parts of success. Treadmill, anti-gravity, robotic walking support. In short, all of this is in today's video. It's a very interesting video. So watch until the end and share it with anyone who needs this rehabilitation. Andrei Berezovsky from Istanbul, from Memorial Şişli, from the Rehabilitation Center. Watch until the end. In this department, we have all the robotic systems, which we have combined with classic therapeutic methods for the maximum benefit of our patients. The robots are used by physiotherapists and physical therapy specialists. And specialists in physiotherapy and rehabilitation, like myself, moderate and oversee the treatment. We use robotic-assisted walking for most patients in the early and middle stages, and we combine this treatment with robotic devices for the hands, since the combination of robots and neuroplasticity produces an excellent effect. That's why we combine both types of therapy. For example, in the morning, the patient undergoes robotic-assisted walking, and in the afternoon, robotic therapy for the hands and shoulders. This is also carried out together with physiotherapists and occupational therapists. Physiotherapy and occupational therapy sessions are integrated with robotic systems and help accelerate progress. Sometimes it is robotic therapy that enables the patient to reach the necessary level of progress. After that, we use an anti-gravity treadmill. Anti-gravity therapy allows for easier movement and improved muscle use through support. That's why it's very important to create different conditions and environments to provide the appropriate treatment for the patient. If the patient is already walking confidently, we use balance training. Such training is necessary to prevent falls. Falls are a serious problem for patients, so their prevention is very important. We combine gait therapy with balance training. In this way, these methods provide significant improvement in patients' conditions.
At the age of 16, Sude Yilmaz suffered 2 consecutive brain hemorrhages due to congenital reasons and a disease that developed in her brain. This bright young girl suddenly found herself bedridden.
Sude's rehabilitation potential, was between low and non-existent. There is a physical therapist involved in the case, as well as an occupational therapist, a speech and swallowing therapist, and a specialist in cognitive rehabilitation methods of physiotherapy. There is also a physician specializing in physical therapy and rehabilitation who coordinates this team.
After 6 months, the wonderful Sude returned to her former days.
Thanks to the meticulous work of medical professionals, both through their efforts and their compassion, and because everything was done correctly.
Previously, robotic technologies were not so widespread or advanced. But over the past 15 and especially the last 10 years, robotics has made tremendous progress. That's why we combine classical treatment methods with robotic ones. Robots have expanded our capabilities in managing patients with various conditions. They make the rehabilitation process easier. But it's important to understand that robots alone do not treat patients. Doctors use the capabilities of robots to provide effective treatment. That's why an experienced team is still the most important factor. Advanced treatment methods are also important when combined with robotic technologies because good robots allow patients to recover better and faster. That's why this is extremely important for us. Currently, robots are integrated with virtual reality, but there is no augmented reality yet. And artificial intelligence is a potential for the future. We are looking for new approaches based on combining with artificial intelligence. At the moment, virtual reality and robotic treatment combined with classical therapy are available in our department. Look, behind me is an anti-gravity treadmill. We are in the rehabilitation center at Memorial Şişli. And the point of this machine is that after a stroke or a car accident, you need to start walking again. But how do you start walking if you can't? How do you restore muscle memory? It creates the effect that you are without any load. They reduce the load basically, they remove your body weight using negative pressure. So essentially, instead of carrying your full 80 kilograms, you're only carrying 20 kilograms. And gradually, step by step, they bring the load back up. It's like a miracle. Everything depends on the patient's condition. But when it comes to neurorehabilitation, there's a saying that the whole world agrees with: time is brain. If a patient is admitted to the hospital after emergency therapy or surgery, then the earliest possible time is the best time to start rehabilitation. Because at the beginning, it's easier for us to manage all of the patient's conditions. If treatment is started later, the effect will be weaker than if it started early. That's why time is brain. We want to admit patients right after intensive care or surgery. This is very important. The most valuable thing is to restore the patient's ability to live independently in everyday life. At first, we're happy when the patient regains consciousness. Then comes a very important first milestone. It is crucial to help the patient regain the ability to walk, as well as to restore their speech and communication. If by the end of rehabilitation we can help the patient achieve independence in daily life, that is the true miracle of therapy, which also inspires us ourselves.
A 33-year-old young businessman living in northern Cyprus suddenly suffered a brain hemorrhage. The patient, who was brought to Istanbul when he was on the verge of death, was able to stand up and even started singing after 4 months of physical therapy. Izar Küçük, 33 years old, collapsed to the ground and was immediately taken to the hospital by his friends. The young man suffered a stroke. The brain hemorrhage that was immediately detected left Izar Küçük bedridden. When he felt unwell for the third time, he was urgently taken to the hospital and operated on immediately. The brain hemorrhage was eliminated, but his condition remained poor. To be honest, his consciousness never fully returned. He was in bad shape, he was very weak. He didn't remember anyone. The family waited for his recovery for 40 days, but nothing changed. This time, the family transported their son, who was semi-conscious and bedridden, to Istanbul on a medical plane. At the stroke center for 4 months, physiotherapy exercises were carried out to reactivate all his muscles and nervous system. Every day, Izar Küçük was coming back to life. By the end of the 4th month, the young man was able to walk and speak on his own. He even started singing songs.
Yes, the surgeons performed the operation. After this, some are immediately admitted to the ward, while others remain in the intensive care unit for some time. Then the patient is transferred to a regular ward. On the first or second day, we examine the patient. If the patient needs therapy, we start quickly, because after a successful operation, the patient needs mobilization, and that's our job. We can sit, lift, or help the patient stand up, because for us it's very important. The earlier rehabilitation begins, the better. The brain loses most of its neurons during the injury. Then we create new neural connections and new ways to use the body. Some nerves and neurons in the brain are able to learn various new tasks and skills, so effective treatment often requires consistent repetition and time.
This device is an anti-gravity treadmill. You could call it a spacewalk on our device.
It can increase our weight up to 80%. But if you weigh 100 kilograms, we can reduce it to 20. Later, when we see progress in the patient, for example, the patient starts getting up faster, their walking speed increase, we begin to increase the load. As I mentioned, we start increasing from 7% to 25%, 30%. We can also speed it up independently depending on the progression of the disease. There is no risk of falling. It's very safe.
Timing matters. For example, in traumatic surgeries, we work together with surgeons to determine the optimal moment. The combination of methods is also important, not just physiotherapy, but in conjunction with occupational therapy. Respiratory rehabilitation is extremely important for our patients. For instance, if you don't work on the patient's breathing together with a specialist, it's impossible to achieve functional improvement. Breathing plays a key role. Patient communication is also important, so sessions with a speech therapist or a swallowing specialist are very important. In summary, comprehensive rehabilitation by the entire team is critically important for successful treatment. You can also see ping pong. When a patient starts to use their hand, we also add physical games to the patient's treatment program. This is very important. Some virtual reality games and physical games make the brain more receptive to learning. As a result, both motivation and the ability to learn increase at the same time. That's why we always integrate games into the treatment process. I also want to tell you about this device. This is a special device for patients in the early stages. It is a robotic bed for early standing and walking. The patient lies down while we monitor their breathing, pulse, and overall condition, as well as how these parts of the robot make the patient walk passively. When the patient starts to use their legs to push, we measure the pressure and the leg's ability to move using a computer. Next, in the early stage, when the patient reaches a vertical position at 90 degrees and stabilizes, we transfer the patient to active robotic walking, which provides full body weight support. It also moves the patient passively. But if the patient starts to make some movements on their own, we shift the responsibility to the patient and gradually reduce the device's anti-gravity effect, helping the patient to walk independently. Meanwhile, patients see an avatar of themselves on the screen and can play fun games. This also enhances the brain's ability to learn. One common problem is that if a patient has suffered a traumatic brain injury or a stroke, many people say, take them home, let them rest, and if things get worse, bring them in for rehabilitation. This is wrong. This is a big mistake. If we want successful rehabilitation after the acute phase, we must begin full recovery immediately. Even more than that, we are not just supposed to, we are obligated to provide the patient with a comprehensive full-scale rehabilitation. This is the key point. But most people do not realize its importance. Physiotherapy, occupational therapy, or ergotherapy, and as it is also called pulmonary rehabilitation, speech therapy, and swallowing therapy, are all very important. Medication is also important because certain drugs are necessary during treatment, some for the brain, some for the heart, and some for the general condition. Thus, combining medical treatment and rehabilitation enables the patient to recover. We also have an area for occupational therapy. Here, our specialists offer modified hand therapy techniques, which are also used for children. They try to help patients use or improve their abilities in everyday life. For example, a patient can use their hands at 50% capacity, but cannot put on a t-shirt. The occupational therapist offers the patient new methods for performing such tasks. Sometimes special devices are used so that the patient can handle everyday tasks more easily. That's why we combine classical and robotic rehabilitation with medical expertise. This is exactly what makes the therapy effective for the patient. At the first stage, it's necessary to address all of the patient's problems. What does that mean? It means assessing their functional condition. Can they use their hands, speak, understand, see and hear normally? Next, if there are problems with the lungs or heart. Many patients have heart problems that were previously unknown, and this may be related to their current condition. For example, if a patient has issues with their pulse or hypertension, this could have triggered a stroke. That's why it's very important to conduct a detailed assessment of the patient's overall condition. Next, it's important to determine the patient's needs. For example, if the patient has had a traumatic brain injury, it's important to examine the whole body because such an injury could also have caused problems with the spine or joints. That's why a complete and thorough examination of the body is very important. Especially if, for instance, due to the urgency of the brain condition, doctors postponed other examinations. Therefore, if we are admitting a patient after an injury, we always conduct a full body examination, a physical exam, CT scan, sometimes X-rays and sometimes MRI. All of this helps us to accurately understand the patient's condition.
I had the brain hemorrhage twice, once in August and again in September. After the first surgery, I was discharged following 20 days of intensive care, but I had another brain hemorrhage. My left side was paralyzed.
A very motivated family. They have everything with Miss Armagan. They work very well with the team because the role of the family in this treatment is extremely important.
And the person who made this miracle happen is my teacher, Engin Çakar, and his physical therapy expert.
After Armagan became more aware, she made a very positive contribution to the entire process of physical therapy and rehabilitation. She set goals for herself and worked very hard to achieve them. Since she was young, her brain tissue responded very quickly, and she was able to return home by the second month.
Yes, that's a good question because we accept patients from different hospitals, different countries and different cities. Since we have a simple procedure here, we need all the patient's medical discharge papers, especially clinical conditions, MRI and CT results and reports, and sometimes the MRI images themselves. We also need a functional video of the patient. A short video is important to get a general idea of the patient's condition. For example, if the patient is lying down, just give a command, move your hand, look at me, follow my finger. Can he speak, make sounds? If the patient can stand up, sit down, or walk, anything that can be shown in a 1-minute video, that will be enough for us. The important thing is that we are a specialized neurorehabilitation clinic. We can also provide musculoskeletal rehabilitation, but our main specialization is neuro, especially strokes and traumatic brain injuries, as well as complex conditions such as polytrauma. And I have experience in rehabilitation because I used to be a military doctor and our center was focused on rehabilitation. And our teaching hospital, formerly a military teaching hospital, is one of the best concepts in the world. That's where my training and education began. Later, the Memorial Hospital Group fully supported me and my team. They provided all the technology and organized teamwork. They give me every opportunity so we are able to work with high quality, and we also conduct scientific research on the brain and rehabilitation. This helps us constantly update our knowledge. Interaction with other hospital departments is also important, for example, with the surgery, neurosurgery, and neurology departments. Renowned specialists in this field work here. We work as a well-coordinated team. It's a team effort which delivers excellent results for patients. We mainly take on moderate and severe cases. That is indisputable. Patients in the early stages after a stroke or brain injury need comprehensive inpatient rehabilitation. There is no debate about this. If there is a patient and the opportunity to provide comprehensive rehabilitation, intensive rehabilitation should be started. The decision to conduct it in an inpatient or outpatient setting depends on the physician's assessment of the patient's condition. But initially, most patients need exactly this kind of treatment. We have many cases, some of which are very interesting. We have different types of severe patients. They help each other. Awareness is very important. These patients are ideal participants for informational campaigns. That's why you can check out our YouTube channel, Engin Çakar Memorial Istanbul Rehabilitation Academy. Almost every severe patient has their own unique story. Their families say that many hospitals and even countries refuse to admit them because of the high risk of death. The risk of death is a very serious issue because no one wants a bad outcome and no doctor wants their patient to die. That's why we discuss all of this with relatives. We ask directly, do you understand how risky this situation is? Our patient either has a high risk of death or a chance for recovery. These are two sides of the same treatment. If you want to continue treatment with us, you must clearly understand this reality. This is not the hospital's problem, not the doctor's problem, and not even your problem. It's simply the situation. It's a fact and a reality. If you want to face everything together, yes, we are a multidisciplinary hospital. We work as a comprehensive team. We will do our best, but we cannot change fate's verdict. Sometimes you do everything you can, but you still can't restore a patient to a full life. That's why our mission is to provide the best rehabilitation care, competent recovery, proper medical treatment, and to wait together for positive results. And the team includes the family. The family is not just present, they are part of the team. Family and medical staff together, patient is at the center of attention. That's why if a patient's family understands the complexity of the situation and is ready to be part of the team, we accept even the most severe cases. This is why most of our patients are severe cases, because many of them couldn't find a hospital that would take them in. But we accept them if the family is aware of the situation. So you can check out our YouTube channel, as well as our website, Instagram, and YouTube. All our complex patients and their families share real stories. You'll find many different stories there. This isn't just the reality of our department, it's the reality of life itself. Stroke is usually considered a problem of the elderly. But statistics show that 22% of stroke patients are under 45 years old and 65% of patients are younger than 70. This is official statistics from international stroke data. Traumatic brain injury is an extremely serious problem. Falls, accidents, wars, gunshot wounds, these are common causes, and of course traffic accidents. In many countries, this is a huge problem. The speed of the accident. About 70% of those injured in traffic accidents sustain injuries. If they survive, they require long-term rehabilitation. That's why our patients vary in age. We have many young patients and even children. A young brain is more flexible, and neuroplasticity processes occur more easily. But even in elderly people, even those over 70, there is potential for neuroplasticity, so we do not set age limits. If we admit, for example, a 22-year-old patient, and he recovers, walks and talks, he can live to 90 or even 100 years old. But sometimes we admit a young patient and we are unable to achieve progress. Everything depends on the situation and the patient themselves. It is very important what the condition was before the injury. Premorbid status, for example, heavy drinking or smoking, hinders recovery. That's why you can't judge based on age alone. Age is important, but it's not the only factor in recovery.